If you are over 65 and your blood pressure has been a little high for years, even if you feel completely fine, please do not skip this video. High blood pressure does not just affect your heart the way most people assume. It quietly damages several other parts of your body as well, often for years before any noticeable symptoms appear. Today I am going to walk you through 7 specific body parts that high blood pressure can seriously affect after the age of 65, and most seniors have no idea this damage is already happening. Hi everyone, I am Dr. Kaivor, and I am a health specialist. Over the years, I have worked with many patients who believed that as long as they felt okay day to day, their blood pressure was not really a problem worth worrying about. The truth is that high blood pressure is often called the silent killer for exactly this reason. It can quietly damage multiple organs at once, long before you ever feel anything is wrong. I want to walk you through this clearly today, not to frighten you, but to help you understand exactly what is at stake and what you can do about it. I remember a patient, a retired teacher in his early 70s, who had lived with mildly elevated blood pressure for over 15 years. He always felt fine, so he never took it especially seriously. It was only after a routine eye exam revealed changes in the blood vessels at the back of his eyes that we realized just how much long-term damage had already occurred, not just to his eyes, but likely to several other organs as well. His story is a perfect example of why understanding these 7 areas matters so much, because the damage from high blood pressure is almost always silent until it suddenly is not. The first body part I want to talk about is the heart itself, because this is where most people expect the damage to occur, even if they do not fully understand how. When blood pressure remains high over a long period of time, your heart has to work harder with every single beat to push blood through your blood vessels. Over years, this extra effort causes the walls of the heart, particularly the left side, to thicken. This thickening is called left ventricular hypertrophy, and while it sounds like the heart is getting stronger, it actually makes the heart less efficient and more prone to failure over time. This is one of the leading reasons seniors with long-standing high blood pressure eventually develop heart failure, where the heart struggles to pump enough blood to meet the body's needs. The second body part is the brain, and this is an area that I think deserves far more attention than it usually receives. High blood pressure is one of the largest controllable risk factors for both stroke and a slower form of damage called vascular dementia. Over time, elevated pressure can weaken or narrow the small blood vessels that supply different regions of the brain. Sometimes this leads to a sudden, obvious stroke. Other times it leads to a series of tiny, often unnoticed strokes that gradually affect memory, concentration, and decision-making. Many seniors and their families attribute this gradual decline to normal aging, when in reality, long-term high blood pressure may be playing a significant role. The third body part is the kidneys, which rely on a delicate network of small blood vessels to filter waste from your blood. High blood pressure damages these tiny vessels over time, reducing the kidney's ability to filter properly. This can progress slowly over many years without any noticeable symptoms until kidney function has already declined significantly. What makes this particularly concerning is that damaged kidneys can then raise blood pressure even further, creating a cycle where each problem makes the other worse. By the time symptoms like swelling, fatigue, or changes in urination appear, kidney damage has often been progressing quietly for a long time already. The fourth body part is the eyes, specifically the small blood vessels at the back of the eye in an area called the retina. High blood pressure can cause these vessels to narrow, leak, or even bleed slightly, a condition known as hypertensive retinopathy. In many cases, this causes no noticeable change in vision at all, which is exactly why routine eye exams can reveal blood pressure-related damage long before a person notices any symptoms themselves. This was precisely what happened with the patient I mentioned earlier. His vision felt completely normal, yet the changes in his retina told a very different story about what years of elevated blood pressure had been doing internally. The fifth body part is the arteries throughout your entire body, not just near the heart. Constant high pressure causes the walls of your arteries to gradually thicken and stiffen, a process called arteriosclerosis. Stiffer arteries are less able to expand and contract properly with each heartbeat, which in turn raises blood pressure even further and creates additional strain on the heart. This stiffening also makes arteries more prone to developing fatty deposits, which can eventually narrow or block blood flow to vital organs, increasing the risk of heart attack, stroke, and other serious complications. The sixth body part is the blood vessels in your legs and feet, an area many seniors do not associate with blood pressure at all. High blood pressure contributes to a condition called peripheral artery disease, where narrowed blood vessels reduce blood flow to the legs and feet. Early signs can be subtle, such as cramping or aching in the legs while walking that improves with rest, or feet that feel unusually cold compared to the rest of the body. Left unaddressed, reduced circulation in this area can lead to slow healing wounds, infections, and in more serious cases, an increased risk of amputation, particularly in seniors who also have diabetes. The seventh body part is your memory and overall cognitive function, which I want to discuss slightly differently from the brain damage I mentioned earlier related to stroke. Beyond the risk of stroke and vascular dementia, research has increasingly shown that long-term high blood pressure, especially when poorly controlled during midlife and into the senior years, is associated with a general decline in memory, processing speed, and the ability to focus, even in people who never experience an obvious stroke. This type of gradual cognitive change is often mistaken for simply getting older, when in reality, better blood pressure control earlier in life might have slowed or reduced this decline significantly. I want to spend a moment on each of these areas a little further, because I think the details matter when it comes to actually recognizing what is happening in your own body. When it comes to the heart, many seniors are surprised to learn that the thickening I described earlier can happen even when blood pressure readings look only mildly elevated, particularly if those readings have stayed consistently high for many years without much variation. This is part of why doctors often emphasize long-term control rather than focusing only on a single reading taken during a checkup. With the brain, I want to highlight that the small, often unnoticed strokes I mentioned are sometimes called silent strokes, and they can occur without any of the sudden dramatic symptoms most people associate with a stroke, such as facial drooping or sudden weakness on one side of the body. Instead, the cumulative effect of several silent strokes over time can look more like gradual forgetfulness, difficulty finding words, or subtle changes in personality, which families frequently attribute to normal aging rather than connecting it back to long-standing blood pressure issues. For the kidneys, it is worth mentioning that this organ has a remarkable ability to continue functioning even when a significant portion of its filtering capacity has already been lost. This means that by the time blood tests reveal reduced kidney function, the underlying damage has often been building for years. This is exactly why routine blood and urine testing, even when you feel completely well, plays such an important role in catching this kind of damage early. When it comes to the eyes, I often tell my patients that the back of the eye is one of the few places in the entire body where a doctor can directly observe the condition of small blood vessels without any invasive procedure at all. This is part of why eye exams can sometimes reveal blood pressure-related damage before any other test does, simply because the retina offers such a clear window into how your blood vessels are holding up throughout your body. I also want to briefly explain the underlying reason high blood pressure affects so many different organs at once, because understanding this mechanism makes the rest of this video much easier to follow. Every organ in your body depends on a steady, well-regulated supply of blood delivered through small and large blood vessels. When pressure inside these vessels remains elevated for years, the constant force places mechanical stress on the vessel walls themselves, not just on the heart that is pumping the blood. Over time, this stress damages the delicate inner lining of blood vessels, called the endothelium, making them less flexible and more prone to injury, inflammation, and the buildup of fatty deposits. Because nearly every organ in your body relies on healthy blood vessels to function properly, this single underlying process can quietly affect the heart, brain, kidneys, eyes, arteries, legs, and even memory all at once, even though these areas might seem completely unrelated to each other at first glance. Now that we have gone through all 7 areas, I want to talk about why this matters so much specifically for people over 65. As we age, our blood vessels naturally become somewhat stiffer, regardless of blood pressure, which means any additional pressure from hypertension causes proportionally more damage than it would in a younger person. Seniors are also more likely to be managing multiple health conditions simultaneously, such as diabetes or high cholesterol, which can compound the damage that high blood pressure causes to each of these 7 areas. This is why blood pressure management becomes even more important, not less important, as we get older, despite the common misconception that slightly elevated numbers are simply expected and acceptable with age. I also want to address some common mistakes I see seniors make when it comes to managing their blood pressure. The first mistake is assuming that because they feel fine, their blood pressure must be fine as well. As I mentioned earlier, damage to these 7 areas often occurs silently for years before any symptoms appear, which means feeling well is not a reliable indicator of safety. The second mistake is becoming inconsistent with medication, either skipping doses when they feel good or stopping medication altogether without consulting their doctor first. Blood pressure medications work by maintaining consistent control over time, and stopping them abruptly can cause sudden spikes that are particularly dangerous. The third mistake is relying solely on occasional readings taken at the doctor's office rather than monitoring blood pressure regularly at home, since blood pressure can fluctuate significantly throughout the day and a single reading may not reflect your true average. So what can you actually do to protect these 7 areas starting today? The first step is to monitor your blood pressure regularly, ideally at home, using a properly calibrated monitor, and to keep a simple log of your readings to share with your doctor. This gives a much clearer picture than occasional readings taken only during medical visits. The second step is to take your medications exactly as prescribed, at the same time each day if possible, and to never stop or adjust your dosage without speaking to your doctor first, even if you are feeling completely well. The third step is to reduce your salt intake, since excess sodium causes your body to retain fluid, which directly increases blood pressure. Many seniors are surprised to learn how much sodium is hidden in processed foods, canned soups, and restaurant meals, often far more than what they add themselves while cooking at home. The fourth step is to stay physically active in a way that is appropriate for your current fitness level. Even gentle activities like daily walking, swimming, or light stretching can help improve circulation, support healthier blood vessels, and assist with overall blood pressure control over time. The fifth step is to schedule regular checkups that specifically monitor the areas we discussed today, including kidney function through blood and urine tests, eye exams that check the retina, and conversations with your doctor about memory and cognitive changes, rather than waiting until symptoms become obvious in any of these areas. The sixth step is to pay attention to early warning signs specific to each area, such as leg cramping while walking, subtle changes in vision, unusual swelling, or noticeable changes in memory or concentration. These signs do not necessarily mean something serious is happening, but they are worth mentioning to your doctor rather than dismissing as simply part of getting older. The seventh and final step is to involve your family in this process. Many seniors manage their health alone, which means subtle changes in memory, mobility, or behavior might go unnoticed simply because no one else is observing these patterns closely. Letting family members know what to watch for can make a meaningful difference in catching problems earlier. I want to go back to the patient I mentioned at the beginning, the retired teacher whose eye exam revealed years of hidden damage. After that discovery, we worked together to get his blood pressure under much better control, and over the following years, his kidney function and overall cardiovascular health remained far more stable than they likely would have otherwise. His situation is a clear reminder that it is never too late to make meaningful improvements, even after years of elevated blood pressure. I also want to mention a few specific risk factors that can make this kind of damage progress more quickly, so you can be especially mindful if any of these apply to you. Smoking significantly accelerates damage to blood vessels throughout the body, compounding the effects of high blood pressure on every single one of the 7 areas we discussed today. Diabetes works in a similar way, since high blood sugar also damages blood vessels directly, meaning that having both high blood pressure and diabetes together causes considerably more harm than either condition would on its own. Being significantly overweight places additional strain on the heart and blood vessels as well, while also making blood pressure itself more difficult to control. None of these factors are mentioned to place blame, but rather because addressing them, even partially, can meaningfully slow the kind of organ damage we have been discussing throughout this video. I also want to briefly mention sleep, since it is something many seniors overlook when thinking about blood pressure. Poor sleep quality, and in particular a condition called sleep apnea, where breathing repeatedly stops and starts during the night, can significantly worsen blood pressure control. If you snore loudly, wake up gasping, or feel excessively tired during the day despite spending enough hours in bed, this is worth mentioning to your doctor, since treating sleep-related issues can sometimes improve blood pressure control more than people expect. I want to leave you with this. High blood pressure does not announce itself loudly in most cases. It works quietly, affecting your heart, your brain, your kidneys, your eyes, your arteries, your legs, and your memory, often all at the same time, long before any of these areas show obvious symptoms. The good news is that with consistent monitoring, proper medication use, and a few meaningful lifestyle adjustments, much of this damage can be slowed and in some cases, even partially reversed. Keep monitoring your blood pressure regularly, stay consistent with your treatment plan, and do not assume that feeling fine today means everything is fine internally. Small, steady efforts made now can meaningfully protect these 7 areas for years to come. Even modest improvements, such as lowering your average reading by a small amount through consistent medication and lifestyle changes, have been shown to noticeably reduce the long-term risk to your heart, brain, kidneys, eyes, arteries, legs, and memory, which is exactly why consistency matters more than perfection when it comes to long-term blood pressure management. If this video helped you understand something new about your own health, please share it with a family member or friend who might benefit from hearing this, especially if they have been told their blood pressure is a little high but have never fully understood why it matters so much. If you would like more clear, practical health guidance like this, subscribe to this channel and turn on notifications so you never miss an important video. Take care of yourself, prioritize your health, and I will see you in the next video.